Thank you, Marty. I appreciate that. I am going to get my screen share going here. Is that coming through okay?
Looks good.
Wonderful. Well, as Marty said, I am Kate Othus. I'm the president of Health Professionals Alliance. My colleague, Dan Barnett, is also on screen here with us. Say hi, Dan.
Hi,
Down
everyone.
with the yell hat. All right, so I have spent my career working with doctors in various capacities. The first 10 years of the career was with doctors side by side in their practices as their practice administrator or CEO in multi-specialty groups, orthopedics, trauma, general surgery, what have you. And then I transitioned to consulting. And during that time, I joined a regional CPA firm, became an equity partner, and helped lead their healthcare practice. And that was an extension essentially of working with the doctors, but in a better capacity because doctors are really hard to work for. So working with them side by side, helping, improve their practice margins, contracts, whatnot. During that time, I built a data analytical tool called DataDX, and I'll talk a little bit more about that later. But I also taught as an adjunct professor at Oregon Health Sciences University, strategic planning and operations management. And so I have an extensive background in healthcare, and our entire team does as well in various capacities, either working with doctors inside of practices or on the business side of buy-sell arrangements, transitions, and whatnot. So we're trying to really build this alliance to help fuel private practice and save it because it's under attack. Let's see here. All right, so as I said, it's under attack. Private practice is dying. It's very constrained. COVID compounded the problem. Doctors are suffering from increased regulations and shrinking margins. A recent study that was just produced early in Q1 of this year shared that doctors are spending only 27% of their time actually providing patient care. So that means the rest of that time is on some type of administrative drag, billing and collections, electronic medical record entries, probably trying to run their business and or learning about new treatment modalities and technology. So they're not actually spending very much time with patients, which is really unfortunate. So, and with the limited number of hours in the day and their shrinking margins, they can't just make up for that by adding volume. So this is causing doctors to feel like they're forced into consolidation. Doctors in private practice in particular are up for grabs and also constrained by 4 different sources. And so I want to make sure you understand what those are. Private equity is a big source, hospitals purchasing physicians or their groups, insurance companies and their policies, and governmental regulations. So as most people know, healthcare in the United States is over 18% of GDP. A misnomer that's very common is that doctors are a large part of that spend, but doctors are actually around 21% of that spend. So most of the healthcare dollar is going to pharma, insurance companies, hospitals, and not actually to the doctors providing our care. So, and that this is set up this way to help control the flow of both money and basically the referral of the patient. If they can control that, they're controlling the distribution channel essentially for patient care. And so we want to help disrupt that. So what is HPA? HPA brings a technologically advanced set of brain power, capital, best-in-class services, all poised to help private practice doctors. It's built on the idea that elevating physicians and dentists, so we're not mutually exclusive with just physicians, we span both sides of healthcare. We want to fuel their practices with more choices, the most innovative tech tools, superior consulting services, basically to liberate healthcare for future generations. We exist to serve as an ardent market disruptor for an industry that's built with excessive waste, all that waste that I just quoted earlier with the GDP and a large percentage that doesn't even go to the doctors that are serving us. It's lost sight of its purpose, our industry of healthcare. The purpose is to serve its people, our patients. So together, we want to disrupt the current landscape and put the care of patients back into the hands of doctors. We also want to bring price transparency, which is a huge problem in medicine today as well, and insights to the true cost per unit of care. So that's why we partner with DataDX inside of the Alliance to help bring real-time cost information to our practices. basically trying to bring, the small and mighty, independent groups, the power of the big box, but without the restrictions and the predatory features. The business model of Health Professionals Alliance is really quite simple. As I stated, we're trying to fuel the practices with data, people, capital, and expertise, all needed to drive results and provide excellent patient care. Our organization is on the pathway to go public, and therefore any of our owners, we extend an ownership model to our practices. Their practices would be public as well. This is something that a private practice could never do on their own, and helps enhance their value in future retirements and recruiting abilities for their practice. So how do we do it? The 4 steps are pretty simple. We aggregate a large number of doctors through our membership-owned platform. We provide a suite of services via that membership model, largely technology enabled, but we still need people too. We evolve the concierge model inside of healthcare and create a new type of patient financing and bundled payment. Bundled payment is something that's been in existence for about the last 10 years, but it's very constrained and hard to administer. We want to improve that. And furthermore, the last step, creating an HPA membership directory for patients to elect the best possible care at the best possible price. All right, so HPA understands what it takes to drive share value, and the Alliance, it basically is what we call our memberships, happens to be built on that foundation and echoes our revenue model as well. So we have what we call our practice equity program, is how our physicians and dentists and their practices become owners in the Alliance. The program is very simple and non-predatory as compared to the private equity and or hospital employment arrangements that are on the market today. We have very simple features and flexible payment arrangements for our owners, and they're encouraged, they're required to become a member, but they're also encouraged to engage in the services that we provide, both that we own and administer ourselves and others that are on contract. Regardless of ownership status in the Alliance, doctors nationwide are able to become members of HPA. They can be on a retail type of basis and flourish from the services that they're probably already using in their practice, but they're paying a higher rate. So through HPA, they'll receive a discount on those services, but still receive the same quality service. HPA surrounds itself, again, as I mentioned earlier, with a team of practice management and healthcare experts. It does take an army to run a medical practice, and typically these practices are constrained and don't have the resources that they need, and so they can lever from us. We aim to bring solutions and services that not only are best in class, and of course provide those cost savings, as I mentioned, but that provide top line revenue improvements. There are a lot of programs out there administered by Medicare and Medicaid, for example, but that are very administratively challenging for practices to actually bill for and receive that revenue. So we use technology-enabled platforms to help practices do that and increase their top line for things that they're already doing. So this isn't additional administrative burden or churn, but just something that they're not taking advantage of in today's environment. So, and all when possible, again, as you're hearing with the theme, we try to shower the practice with technology and data. And we do that with our real-time data analytics tool, DataDX. So on screen here is a sample report of DataDX. DataDX was specifically built for doctors. As you might recall from beginning of the pitch when I introduced myself, I spent 10 years running practices, and all of that time, or the majority of that time, besides helping lead the people, was spent building financial reports out of multiple systems that did not talk to each other. And I had to put that all into Excel. And being that I'm human and there's only so much time in the day, there would typically be a data entry error or something like that, which would compromise the integrity of the reports and completely steer the conversation away from what we were trying to achieve from a strategic standpoint, or even just operational. And so that's been years. I haven't been inside of a private practice as a W-2 since 2012, but yet the same tools, Excel, are still being used to make business decisions, and even inside large medical groups. So basically practices are lacking resources and expertise needed to understand and define key drivers. Healthcare lives in lagging indicators, and we need to transition that to real time. They need to be able to quickly access the entirety of their operational data with access to measures that are very telling and more outcomes based to demonstrate the value of their care to patients and payers. Another neat feature about Data DX is we've built an anomaly detection system. So what that does is essentially constantly scour the practice data to look for trends, good and bad. So if the practice is flourishing in one particular area, there'll be an alert that might not be on trend, or if collections are down, that's the same thing is alerted. Sometimes it takes several months, 60 days sometimes, to see the trends that are happening in the practice. And that's because the reports are all done after the month has been closed. And sometimes that's, again, like 45, 60, 90 days later. So it's hard to make pivots when needed to address cash flow issues. And COVID really highlighted that for practices. And so Data DX does this in real time. And we're actually working with some fraud experts on the market to build the tool to help identify fraud in a timely manner as well. Medical practices are just rampant with fraud because physicians at times, not always, are not the most business savvy, and they don't have time. As I said earlier, they're spending only 27% of their time with patients, and they don't have time to dig in and look at their financials. They're doing it on a very high level, and they trust the people that run their business by and large. So they need a tool like this to help watch out for their bottom line and make sure that their practice is set up for success, essentially. This is a quote from one of our clients. We work hand in hand with our clients, especially that are using Data DX in our consulting team, to scale that resource and make sure that they're getting all of the benefit from their contracts. So I just wanted to share a little quote. So the growth of the Alliance. HPA was launched in December of 2019, right before the pandemic hit us. And so the timing was a little challenging, but that to be said, in the course of a year and a half, we have acquired 38 member practices, so 38 owner member practices. And of those 38 members, that represents about 28 million in stock purchases. So the shareholders represent 28 million in stock off of those 38 practices. And we have about 100 doctors right now in our prospect pipeline that we're actively talking to, and over 3,000 doctors in our network. Our network is both clients that we're working with now in their contacts, but also includes the 9 contracted service providers that we work with very closely, who deliver key support to our members. We also, at times, HPA receives a revenue share from those key support contracts that I mentioned as well. We've deployed and raised 9.4 million in capital. And our target market, we only need to serve less than 1% of the target market to be successful and meet our projections. And a last good growth metric is that the Data DX SaaS platform, it's a SaaS month per month, onto your contract, but SaaS analytics tool, the subscriptions has grown 438% year over year. So we're in good shape there. And just in case you didn't notice, the TAM for private practice it's approximately 500,000 physicians and 150,000 dentists. There are about 1.2 million total physicians and 200 to 250,000 dentists in the United States. All right, this is our revenue driver. So I kind of alluded to this earlier. So we make our money on our interest payments for our stock purchase agreements, our membership payments, our SaaS subscription model through Data DX, revenue sharing arrangements, and a lending division that we are building through the Alliance. And our average HPA member produces about 72,000 in annual revenue. And our 5-year goals, these are lofty and big, but we have a lot of work to do to help save private practice. So our goal over the next 5 years is to reach 10,000 shareholder doctors, 1 billion in revenues, and 500 million in net income. We have already built the Alliance to be positioned to grow over the entire United States. We have an MSO model specifically built in all 50 states. And as we grow membership, we will deploy contracts for doctors with the health insurance plans to help improve their rates, just as a typical MSO model would do. And then we have an acquisition strategy for growth as well. Some other technology-enabled platforms that we're in discussion with. So HPA will continue to work to help the doctors preserve what they have, protect their practice, and get back their time. In short, hospitals, large corporate medicine entities, and private equity firms are luring doctors into employment arrangements by promising them fewer administrative burdens and that they can just practice medicine. So based on that, you would think that these physicians that are in those arrangements would have lower burnout, but it is in fact exactly the opposite. Independent doctors have lower rates of burnout. So we need to continue to flourish independent doctors and support them. And that is because they have more control over their lives than they do otherwise. The Physician Foundation, this is some promising things. I've kind of laid a dark picture for healthcare, but I have two promising opportunities within the market. One is that because of COVID-19 and the increased restrictions and consolidations within healthcare, over 84% of physicians in particular are reporting that they are willing now more than ever to stand up and take a leadership position to ensure strong, high-performing healthcare systems exist and that they can provide high-quality care to everyone. And also in January, in the first quarter of this year, it was reported that there was an 18% increase in enrollment in medical schools. And so that's been a stagnant number for probably over 10 years. And so we're really happy to see that. If we do this right, we'll build an alliance that physicians can have a choice and doctors alike can come and work inside of HPA instead of going into an employment model. Any questions?
Yeah, Kate, there were several questions, and we're just going to answer a few.
Okay.
But there's a question about aggregating and negotiating rates with medical insurance providers. Do you do that?
Yes. Let's see, I'm reading the question. Isn't it group rates for medical insurance and malpractice? Aggregate, negotiate. So medical insurers and malpractice are different entities. I'm assuming the person that asked that question understands that. We do negotiate rates and aggregate data on behalf of our clients, so on the doctor's practices directly with the payers, and can negotiate contracts and improve those rates. For medical malpractice, as we gain members, we need a larger membership to really hit a meaningful number as far as that goes with medical malpractice rates, but we are in conversation with a few companies and do plan to offer that through the Alliance as well.
Fantastic, Kate. Listen, so just a quick question, and I think you don't really touch on it because you talked about the disappearance of private practices, but I mean, there's going to be a huge turnover in doctoring in the next 10 years, right? I mean, who are educated, they're all retiring. I mean, medical professionals are almost like, building new homes, right? There's a big shortage that's happened over the years, and it's not going to be, easy to replace people by just a 19% increase in medical year, right?
You're absolutely right. And there's going to be a shortage. I mean, it's already hard to get an appointment right now. And even doctors are telling their children not to go to medical school. And so we need to help change that. And if we can be successful, and we have been so far, but we need to continue to be successful and make private practice popular again and get them out of the hospital arrangements, then hopefully more people will continue to go to medical school. But, the fact is the physicians don't make enough money. They go to school for years, and their medical school bills, the college tuition is quite exorbitant. And so the ratio there needs to be improved upon. Yeah,
I think the two stories I know is that our group has there's a doctor out of Texas in our group, and his son went to med school with I think Columbia University. So you live in New York, and just by fluke of nature, he ran into a guy who had gone to med school a few years before him and had joined a hedge fund. And the guy said, "Hey, we're looking for like a junior medical analyst. Do you want to join?" And he saw the pay. He's like, "Oh yeah, I'm out of med school. Forget about it." And he just, ran off and joined this hedge fund, right? So that's, one interesting thing. And then we had another guy who was actually a classmate of mine at Wharton, and he had been a brain surgeon and from Johns Hopkins. And so he said that health insurance had just cut into it. I guess it was Medicare had cut into his rate, that he was like, he said he was doing 4 times as many surgeries, getting paid about 25% the rate of what he had gotten before. So that's when he decided to just, drop it all and go to business school instead. So, there's a lot of questions about how they manage healthcare reimbursements today. And then there's a lot of bureaucracy that's built around it. I don't have a solution, but it's really great what you guys are doing. And so I appreciate it.
Thank you, Marty.